everybody, how are you? My name's Kylie, and I'm a registered nurse, and I'm here today to talk with you guys, and I'm really excited to be here in this group and appreciate that you're here today. I am going to introduce myself a little bit, but I'm really excited to be here today. My background is as a nurse in neonatal intensive care nursing. I started that in 2001, and I have spent about 13 years in NICU nursing. And I loved being a part of the mother-baby world. And then my career sort of changed, and I ended up working in different parts of women's and children's health. So I ended up working in pediatrics. I did OB-GYN. I worked in high-risk pregnancy, and so I have a really extensive background in women's health. I even worked in a fertility clinic for a bit, and I'm really excited to share my experience there if anybody has questions about that. But what I'm really excited about is the plant-based elements of women's health. And I first found a plant-based diet in 2011, so I've been plant-based for, 8 years almost? About 8 years. And it's been a wonderful way for me to manage my health, and I love the way I eat. I pretty much follow the same approach that you're learning for the nutritarian approach. And all of my experience has led me to now work with a company called Mastering Diabetes, and we teach people how to adopt a plant-based diet and whole food plant-based diet. And we work with people primarily who come to us because they have diabetes, but we work with a lot of people who have heart disease and other types of chronic health conditions that they're looking to get support in. And it's really exciting because we also have a lot of women that come to us who are pregnant or looking to become pregnant, many women at different stages of their life who are looking for the opportunity to improve their health or maintain a pregnancy while on a plant-based diet. So with my background in women's health, I've really loved learning more about that process, and so I love to talk with women about how to maintain a healthy pregnancy by following this approach. And I see we have some people joining, so thank you for being here. And hi Tara, how are you? As a plant-based eater myself, I understand some of the challenges and the things that come up on a day-to-day basis that make it challenging, especially when you're considering something like becoming pregnant. How do you talk with your doctors about that? If you've already made the changes in your life to become a plant-based eater, how do you then navigate pregnancy and communicate that with your healthcare team? And these are some of the things that we talk about a lot in our program, but things that I'm also really interested in. So, I welcome any questions that you have. Like I said, I'm excited to be here and have the opportunity to share. And the topic today was basically based on about pregnancy and maintaining a plant-based pregnancy. And it's really exciting because there's not a lot of information out there for women who are already following this kind of an approach and are maybe looking to apply it to their pregnancy or towards their family, growing family. And so some of the things that come up a lot are navigating nutrition throughout the trimesters. And if you're somebody who is thinking about becoming pregnant, there's a lot of things that you can do prior to pregnancy to get yourself into an optimal state so that you can avoid some of the more chronic conditions during pregnancy. And one of those things, by utilizing a plant-based diet, you can achieve your ideal weight. You can prepare your body with nutritious foods, bringing all the vitamins and minerals and wonderful elements of whole foods into your body. And a lot of the talk in pre-pregnancy is about folate and making sure that you have enough folate, because in the very, very, very first stages of pregnancy, we need folate to help the baby's brain grow and nervous system grow. And the wonderful thing is that through a plant-based diet, you get folate directly from the source. And so that's something that's really exciting about eating a plant-based diet, because you actually are already preparing your body in a really healthy way. You get tons of vitamins and minerals that your body needs to support the early stages of pregnancy, things like zinc and magnesium. Like all of those minerals are found in a whole food plant-based diet. And one of the things that can be really helpful when you're first considering pregnancy, or if you find out you're pregnant, is to start a process of food logging, because you can find out so much about your diet when you start actually logging your food. And this is something that I love to recommend to people, just as a way to sort of check in and see, well, what exactly am I getting in the food that I'm eating? Regardless of what diet you're eating, it's important to understand what nutrients are coming from your diet. And one of the things that I found in my own process of food logging is that things like folate and zinc and calcium are actually very readily abundant in my regular diet without adding too much extra. Folate is very easy to find in beans and other legumes. They're a wonderful source of folate. 1 cup of beans contains about almost 250 milligrams of folate, which during pregnancy it's recommended to have 600 milligrams. So you can easily find these wonderful nutrients to support pregnancy just from the food that you're eating. Whole grains, leafy green vegetables like spinach and kale, they're wonderful sources of folate. So, your natural diet will contain a lot of these amazing foods or nutrients that are going to support your pregnancy. And then, so pre-pregnancy, one of the biggest components of pre-pregnancy is really getting to your optimal health prior to pregnancy, if that's available to you. And when you follow a whole food plant-based diet, many women find that if they're carrying excess weight, they're able to lose weight, they're able to maybe reverse prediabetes or type 2 diabetes in advance of becoming pregnant, which sets up for a much healthier pregnancy overall. So the process of adopting this approach prior to pregnancy is really, really important. But if you're pregnant and you're looking for, how do I meet my needs? How do I make sure I'm getting enough of the nutrients that I need? This is a really great topic, because when you become pregnant, the standard of care is that you will receive a prescription for prenatal vitamins. OB-GYN physicians, that's part of the practice, is to make sure that you do get a supplement with the food, regardless of what diet you're eating. But in the beginning parts of pregnancy, you really don't need that many more calories per day. The first part of pregnancy, maybe 100 calories more per day is enough, and you can easily meet that through whole foods. Through fruits are a wonderful source of nutrients and calories to help you as you're navigating the first part of pregnancy. One of the things that comes up in the first trimester is a lot of women experience things like morning sickness, and one of the best things that you can do is to eat carbohydrate-rich foods, and making sure that you have sort of a steady stream of carbohydrate-rich foods throughout the day can really help minimize your symptoms of nausea and morning sickness. So, fruits are a really great source for that. Having a piece of fruit at your bedside when you wake up in the morning, keeping your belly kind of full with whole foods can be a really great way to make sure you're getting enough carbohydrates to keep the morning sickness to a minimum, which is really, really great. Another thing that can be really helpful in that stage in the first part of pregnancy is making smoothies and sort of blended foods, pureed foods, mashed potatoes, things like that you can eat that are soft and more easily digestible, and it helps with some of the symptoms of morning sickness as well. So that's something else that can be really helpful. And so first trimester, most women don't really require a lot of calories, especially if you're entering pregnancy at a normal weight. Extra calories aren't usually needed. But once you get into the second trimester, that's when additional calories are required, and to help your baby grow, help with adding nutrients for your growing baby. And some of the, basically a lot of women, I think a common misconception is when you're pregnant, you need to eat a lot more calories, a lot more energy. And that's true, you do need some more. Your baby is growing, and in the second trimester, it's recommended to have around 350 calories more per day. And you can easily get this through eating additional pieces of fruit through the day, having even a couple of extra 3 bananas can equal around 300 calories. So it's very easy to simply add extra fruit into your diet. Beans are a great source of energy. And so just thinking about how you're planning your day as you move through your trimesters is going to be really helpful for you as well. Another kind of interesting thing about the second trimester is that this is when most women feel really great. And a big part of this lifestyle, this plant-based lifestyle, is also finding balance in your life, finding ways to move your body, and just enjoy preparing delicious foods for yourself. Because the second trimester, usually most women feel really good. So making food that supports how you're feeling, finding ways to integrate lots of a variety of whole foods to get a variety of nutrients, as well as to keep yourself satisfied. It's nice to have a variety of foods. And so you probably would have more energy during this time. You'll also probably have more energy to move your body and to exercise a little bit. So, talk with your doctor about ways that you can move your body, ways that you can maybe go for a walk or go swimming, because that movement is really important for your whole body, and also to feel really great during pregnancy. And so in the third trimester, this is where your calorie intake may increase even a little bit more, closer to 450 calories per day. And again, this is really easy to do by adding a cup of beans or an extra cup of quinoa or other whole grains. Adding more fruit is always a great option. Fruit can add some calories pretty easily, and it tastes amazing. And in the third trimester, this is when a lot of women start to experience a little bit more upset stomach or pressure in their belly and their stomach because of the growing baby. The baby's getting pretty big at that point and putting pressure on your belly. So kind of my recommendation is to go back to things like smoothies and maybe pureed foods, things that you can eat smaller, more frequently, especially when things have already started to break down a little bit inside your belly before you eat them. But during the second and third trimester, the average weight gain recommended is around 1 pound per week. And this may seem like a lot, but a lot of that weight is going right to your baby to start gaining very quickly. And we want to use those nutrients and those calories for all of the work that your body's doing during pregnancy. And it's really easy to do this. And again, food logging. The app that we recommend to people is called Chronometer, and food logging is a great way to see just how many calories you're getting, noticing the nutrients that you're getting in your pregnancy, and finding out ways to adjust based on what your nutrients look like on a daily basis. And so that's sort of a breakdown of trimesters. And then the beyond pregnancy piece is another piece that people usually ask about, because it's a really important time. A lot of women choose to breastfeed during this time, and if you're lactating, you actually need more calories during lactation than you do during pregnancy. So the calorie demand on your body during lactation goes up to about 500 calories more per day. And that's really important because you're producing food for your baby, who's now with you and now is now eating, and you're growing a human. So growing this child. So as your baby's growing, your caloric needs will increase as well. And you can continue to add more calories through fruit and beans and legumes and whole grains, and meet your baby's needs as they're growing as well. If you're looking for a resource around how to look at your nutrients and how to get the best nutrients from your food, the one that I recommend all the time is a book by Brenda Davis. She is a registered dietitian, and she's amazing, and she wrote a book called Becoming Vegan. And the thing about her book that I love is that it talks to people throughout the stages of life. So she breaks down nutrients needed before, during, and after pregnancy. She even talks about how to raise a child on a plant-based diet and how to adequately meet your growing child's needs as well. And so it's a really great way to learn more about the nutrients throughout your lifespan and how your body changes during pregnancy in particular. And then a lot of questions I get a lot about pregnancy is a lot of women are curious about certain vitamins and minerals. How do I know I'm getting enough calcium and things like folate, which we talked about, and iron, and again, these are readily available. Most nutrients are readily available when you eat an abundance of whole foods. And that's a wonderful thing, that you can count on your diet to support you throughout this time in your life where you're going through a transition, and your body may be changing, and you may be doing different things within your daily routines. But the one thing that can be just super supportive is having these nutrients coming in to keep you feeling energized, feeling great, and knowing that your body is going to benefit from all of this wonderful nutrition. But there are certain nutrients that you can't get from a plant-based diet, which I'm sure you've heard about being part of this group, but B12 is one of them, and that's a nutrient that anytime you're following a plant-based diet, it's very strongly recommended to take a B12 supplement, and pregnancy is one of those times, and your B12 needs actually do increase a little bit more during pregnancy. So it's important that, if you do have a prenatal vitamin, that it contains B12, or if you're taking a B12 supplement, that you take it regularly so that you are getting that the appropriate amount of B12. Another nutrient that's really, really important that is low in most people's diets, regardless of what you're eating, is vitamin D. And we typically can get vitamin D from the sun, but unfortunately, sun exposure can become very limited, especially if you're indoors a lot, or with unfortunately not being able to sit in the direct sun for many hours a day, just because of the risks for your skin. So a vitamin D supplement either in your prenatal vitamin or separate from that would be really important, because vitamin D is important for the absorption of calcium. And calcium is a really important nutrient throughout your whole lifespan, and your calcium needs don't really increase that much during pregnancy, but you can help to enhance your calcium absorption by making sure you do take vitamin D supplement, as well as eating lots of green leafy vegetables. Broccoli is a very rich source of calcium. Green leafy vegetables are a rich source of calcium. You can actually get a great deal of calcium from your food that you're eating. So there's some of the nutrients to pay attention to. And a lot of women in general also ask about, how do I get calcium on a plant-based diet, especially when women are concerned about possibility of osteoporosis and bone degeneration. And it's a common question that I get a lot, for sure. And one of the best ways to learn how much calcium you're getting each day is by, again, logging your food. It's a great way to see just how much you're getting. There is calcium to be found in lots of plant-based foods, including in some nuts and seeds as well. And so knowing what you're eating is kind of the key to sort of find out first, what is it that I'm getting, and then how do I then add other foods in so that I'm sure I'm getting the proper nutrients that I need each day. So I'm looking to see if we have any questions coming in. I love taking questions. Another kind of key topic that comes up a lot around pregnancy is a lot of women find themselves facing some health conditions during pregnancy. Sometimes when women are pregnant, it's the first time they've been to a physician or a doctor, and are learning that maybe they have something like prediabetes, or they end up being diagnosed with gestational diabetes. And, in the work that we do with Mastering Diabetes, we have a lot of women that do come to us because they've been diagnosed with gestational diabetes, or they have type 2 diabetes and they're pregnant and they want to manage their blood glucose, because during pregnancy, blood glucose control for mom is super important, because the blood glucose can impact the baby as well. And so when a baby is developing in utero, it receives the glucose that is in the bloodstream. So that glucose is able to cross through the placenta. So if mom has a high glucose reading, the baby's going to also receive that glucose, and will also, if you were to test the growing baby's blood glucose, it would also be elevated, except that growing babies are able to produce their own insulin. And so they will produce their own insulin to basically regulate their glucose inside their own body. And as a result, if they're getting high levels of glucose throughout pregnancy, then their insulin levels can be very high, and after they're born, it can cause baby's blood glucose to go very low. And I worked with a lot of babies that were admitted to our NICU for hypoglycemia, because maybe mom's blood glucose was very elevated during pregnancy, so it was an unmanaged or uncontrolled blood glucose. And so controlling your blood glucose during pregnancy is super important, not just for your own health, but for your growing babies. And one of the things that we see time and again in our program is how women are able to bring their glucose into control and really manage their gestational diabetes using a plant-based diet. And this is a really exciting part of what we're doing and working with people. What I'm learning every day is that women who are pregnant, who are possibly at risk for gestational diabetes, can actually minimize their risk for gestational diabetes, minimize their risk for uncontrolled blood glucose during pregnancy. And that is really exciting, because that means that your baby will be born in a much healthier state, and the risks for I guess there's much better outcomes for the pregnancy in general, but also for a healthy and safe baby birth, and that's the ultimate outcome. We all want to see our babies healthy and our moms healthy as well. So we are really, so anyway, I get to work with a lot of women who are in this process of either trying to reverse their diabetes, their type 2 diabetes, reverse gestational diabetes, or avoid it altogether, because maybe they've learned that they have some high glucose levels, and it's possible. The cool thing is that through a plant-based approach, insulin resistance, which is the root of all of these key pieces, it's the root of gestational diabetes, it's the root cause of type 2 diabetes, prediabetes. Insulin resistance is reversible, and that's the thing that we're seeing, and it's very exciting to see that, and we're really excited to even be producing some information, releasing information about pregnancy and plant-based diet, because right now there's not a lot of information out there. And actually Tara and I were talking about this beforehand, like there's just not a lot of good information for women, and to maybe even approach your physician about this topic. How do I talk to my OB-GYN about a plant-based diet, the fact that I'm eating a plant-based diet? And unfortunately, as maybe some of you know, most of our physicians are not given much training in nutrition. Medical school is really focused on treating patients medically, and most physicians are lucky to have 5 or 10 hours of nutrition education in all of their medical school training. So when it comes to how you're feeding yourself and how you fuel yourself every day, you may have to take that and educate your physician to some degree as well. And one thing that I like to tell people when they're talking with their physician, if it's your OB-GYN physician or even your primary care physician, is that start off the conversation that I have health goals related to my life. My goal is to, if you're pregnant, my goal is to have an uncomplicated pregnancy. My goal is to reverse my prediabetes. My goal is to avoid gestational diabetes. You can use this for whatever your goal is, and maybe your goal is to lose some weight. And just let your doctor know what your health goals are, and that you've learned information about how a plant-based diet can be really beneficial to you in helping you to meet your goals. And some physicians and other healthcare providers are really open to learning from their patients. And if you're seeing great results and you're seeing a consistent, consistency in the way you're able to nourish yourself, and then your physician may get really curious about what you're doing and want to ask more questions. And I always recommend to people to talk with their physician about the things that inspired you. So maybe you saw a documentary, or you read a book. Maybe it was Dr. Furman's book, or other types of resources that are out there that inspired you to make the changes that you're making, and see if they'd be willing to take a look at that and help you on your path to wellness. And I know that in this group, there's a lot of people that come here for so many different reasons, right? Like, we all find a plant-based approach for different reasons, and some things resonate differently for every person. We're going to all resonate with different things. So, offering what inspired you may help your physician kind of understand your perspective, and also help to work with you more. And maybe, your physician may get curious about why you've made these choices. So, there's a lot of great information out there. Another great resource for pregnancy in particular is actually, there's a video course. It's an online course, and it's through the PCRM, which is, the videos are co-founded or co-produced by the PCRM, but the physician who is in the videos is Dr. Gemma Newman. And it's called, I think it's a vegan pregnancy. And I've seen the videos and watched the course, and it's a wonderful resource. If you go to the PCRM website and search for pregnancy, the video course will come right up, and it's a wonderful resource. It's a great place to go to actually learn more details about how to integrate a plant-based diet into your pregnancy and beyond. And Dr. Gemma Newman is amazing. She's so kind, and she has herself adopted a plant-based diet, and she's raising her children on a plant-based diet. And she is based out of London, and does a lot of work in the UK around helping to raise awareness around the benefits of plant-based diet for health, but also for pregnancy as well. So she's a wonderful resource, and I highly recommend that, as well as Brenda Davis's book. I'm not seeing any questions coming in here, but let's see here. Let me see if I see anything coming in. Yeah, I would love to answer more questions if they come in. I can check in on this Facebook Live video and see if anybody had any other questions. I wonder if I see Julia and Kim say hi. Hi guys, thanks for showing up today and being part of the Facebook Live. I am happy to be here, and glad that you guys are on a path to your own health and wellness through the nutritarian diet. But okay, I'm trying to think of what else I was kind of coming today with. Anything else? Oh, protein. Protein is a big question whenever you're adopting a plant-based diet. I did want to mention that during pregnancy, your protein needs do increase. And I know for those of you who have been following this approach for a while, you're probably well aware that we get plenty of protein from a plant-based diet. So, that's a wonderful place to start. When you're not pregnant, your protein needs are around 0.8 grams per kilogram of your body weight per day. And that's based on your ideal weight. So first kind of calculating your ideal weight, and then learning, and then basically calculating 0.8 grams of protein per kilogram per day. And that's pre-pregnancy. And that equates to, for most women, 40 to 50 grams per day based on your ideal body weight. So that's a typical, and for most people, we are able to get that very easily through a whole food plant-based diet. During pregnancy, your protein needs based on a single pregnancy go up to about 1.1 gram per kilo per day. So that ends up being around 60 to 70 grams per day, which is also still reasonable to get your protein that way. So, if you are talking with your physician or another healthcare provider and they're kind of insisting that you need protein, totally true. It's very valid. We absolutely do need protein. It's just that it's very possible to get that in in a whole food plant-based diet, which is really, really great. And again, coming into food logging, coming back to food logging, that's like my kind of, you learn so much from logging your food. And in the food logging process, you can see just how many grams of protein you're getting, and then you can take that information back to your physician or healthcare provider to help you learn and so that you can learn together, really. So, and I do see Cassie has a question. Thanks for asking this question, Cassie. Is there a guideline or website that I can refer to eat my vitamins instead of taking prenatals, or do you recommend a certain kind of prenatal? So, yes, I would recommend starting to log your food in Chronometer, because the Chronometer, there's a website called chronometer.com. You can get it in an app version as well. And that's really the best way you're going to learn just how many vitamins and just how much how you're meeting your vitamin needs each day. And you can actually program in, what your goals are for each of the micronutrients, like all the vitamins and minerals that you would need during pregnancy. I can tell you that offering a prenatal vitamin is a standard OB practice, so that is something that can be very important, especially if you're deficient in any vitamins going into pregnancy. That might be something else to consider, is getting a vitamin panel so that that you're, where you are, because if you're deficient in a vitamin, then either increasing a food that has that vitamin or possibly supplementing with something else might be really important for you. So, I know a lot of women struggle with prenatal vitamins, especially because they can cause a lot of nausea and upset stomach. So looking at different types of nutrients that you're getting from your food to ensure that you're meeting those dietary needs or the nutritional needs during pregnancy is really important. So I would first recommend, logging your food to get a baseline. Like, what am I getting? Then you can ask your physician for a vitamin panel. Ask to have your iron checked, and you can have your calcium levels checked, and have your levels checked, because that way you'll kind of have, again, a baseline understanding of, okay, am I meeting my dietary needs, my nutritional needs every day through my diet, or is there something that maybe I would benefit from in a specific supplement? And then you can supplement specifically. Like, you can just take your B12 and your vitamin D, and maybe, if you and your physician decide that there's another nutrient that you'd benefit from supplementing, that would be really beneficial. Most women who are taking prenatal vitamins, if you do experience like an upset stomach or nausea or vomiting, it's usually from the iron, and you can get iron-free prenatal vitamins. And my recommendation is to look for prenatal vitamins that don't have any added sugar or any added like oils or things like that, because obviously they're not really going to be beneficial for you. So yes, that's one recommendation. And I see Julia has a question. I'd like to hear about fertility treatments. Okay, so fertility treatments vary per person. There's many different fertility treatment options. One of the things that I learned a lot about when I was working in fertility is that achieving your sort of optimal health prior to pregnancy is one of the best things that you can do to support a pregnancy, whether you're conceiving naturally or whether you're looking for fertility support. So, we saw a lot of people who came to us with like elevated A1C, for example, and maybe they had a condition like PCOS or type 2 diabetes, and their A1C was elevated. And so as a result, it's very difficult to have successful fertility treatments when you have an elevated A1C. In fact, a lot of fertility treatments or a lot of fertility clinics have some guidelines around low level A1C, usually under 6.5, before they'll even attempt fertility treatment. So even things as treatments like I'm drawing like IUI, which is intrauterine insemination, and then even as much as IVF. So, having an optimal A1C, and even moving into a non-diabetic A1C prior to pregnancy is really important. And Julia, through a plant-based diet, that is 100% achievable. So, one thing that I would definitely work on is, and I don't know if this applies to you, but, achieving your ideal weight, looking at your blood values for things like your blood pressure, your A1C, making sure that those are all in alignment with the fertility center. And one of the most common causes of infertility for women is PCOS. And we've worked with a lot of women in our program who have come to us because they've had PCOS and they want to reverse the insulin resistance, which is making their PCOS symptoms worse. So insulin resistance is sort of the root below things like prediabetes, PCOS, type 2 diabetes. PCOS is a genetic condition. It's not something that you choose to have, but if you do have PCOS, it makes fertility can become very challenging. And so when you get back to the root of things and reverse the insulin resistance, which is worsening the symptoms of the PCOS, that's where you can see a much easier time. Many women will have a much easier time conceiving once they've brought their A1C down into a non-diabetic range, and maybe have come to their ideal weight or close to their ideal weight. And we actually have a tool that we recommend for people to use. It's called the Insulin Resistance Checklist. And it's a really wonderful tool because it allows you to look at some of your biometrics, like your A1C, your fasting blood glucose, your blood pressure, your weight, very simple biometrics that you can use to understand your own level of insulin resistance. So I would recommend that, and what I can do is actually, after this is over, I can post it into this comment thread, and that way you can take a look at that, because it's a great tool that I actually developed because as a nurse I'm like checklist friendly. I'm all about the checklist, and it helps you, give you some parameters about how to achieve your best health, and hopefully then fertility would become a much easier topic for you. I see Cassie wrote a follow-up question here. I'm under producer of breast milk. Both of my sisters. I have heard that this is an issue. Oh, yeah. For milk supply. Cassie, are you drinking mother's milk tea by chance? Mother's milk tea is a wonderful supplement. It has fenugreek and another root in it that is amazing. You can get it at most like health food stores. I'm sure Whole Foods sells mother's milk tea. It's a wonderful addition, and there's lots of great nutrients that will help to boost your milk supply. Yeah, I would definitely, if you're, okay, so 7-month-old baby gets everything, I know breastfeeding can be challenging, so keep up the great work. You're doing an amazing job by offering. Nothing seemed to change. Oh, sorry. Have you, one other question I would have for you, Cassie, is possibly to get your testosterone levels checked. With PCOS, many women with PCOS do have elevated levels of testosterone, and that actually impedes fertility and can also impede other hormones that, again, are, your hormones may be out of balance, which could impact your milk supply as well. Our endocrine systems are so sensitive, and they're, rightly so. They're controlling so much of what our body is doing every day. And for women especially, our hormonal balance is so important for, regular cycles, for producing milk, for, during pregnancy. So, our hormone balance is changing every day. Our cycles change us, and we are changing beings. Where, men tend to have a much more steady state when it comes to, especially when it comes to like sex hormones or the reproductive hormones. So I would definitely, one thing you could do is check your testosterone levels and just see where you are, because, maybe if that's something that is out of balance, it could impact your, your hormones impacting your breastfeeding as well. But I'm sorry that you're not seeing the supply that you were hoping for. But it's such a great job. I mean, for 7 months, for a 7-month-old baby, breastfeeding regularly throughout the day, you're doing a great job. So just keep up the great work and just know that your baby is getting such great benefit from your breast milk every single day. When I worked in the NICU, we did have a lot of women really struggled with producing breast milk because they were pumping breast milk. They weren't able to feed their babies right away. And, that might be another strategy. I don't know if you've considered adding some pumping into the mix, Cassie, but sometimes the stimulation, it sounds like you're probably breastfeeding around the clock, but that might be help to bring some of your supply up a little bit more. But it's really frustrating when you're not seeing the production as much as you were hoping. But what we would talk to our families about in the NICU is every drop of breast milk is valuable. So every single drop that your baby is getting is so important for all of their development. So you're doing an awesome job. Well, we've covered quite a bit here. I thank you guys for being here and being part of this Facebook Live event, and also for being part of the Nutritarian group. This is a really wonderful community. I recently actually just joined it, so I'm hoping to be able to pop in and be part of the community as well. I do talk with people every day about plant-based nutrition because that's what my role is now, and I'm a coach with the Mastering Diabetes program, and so this is what we do every day. So I love talking about it, and I'll be happy to jump in and help to maybe chime in a little bit. And I hope you guys have a great rest of your day, and hope that we cross paths again sometime in the future. Take care.